So in the name of Jesus, I start. So as you guys know, this is how I study, and I'm just doing it here to empower myself. Most of the stuff that I'm using here are from YouTube. I just took their pictures and then used them. There's one person called Dr. Ibrahim. So that's the person you should look for, and that have this incredible videos. So today is the test of the proximal and the distal interphalangeal joint. So before we dive into it, let's see now where is this distal and the distal and the proximal interphalangeal joint. So these are the two joints we will be talking about. These are the two joints. So this is the distal and this is the proximal. So with those two joints, we're going to first talk about the anatomy of how these joints will be, the movement in those joints. So the movement is, this joint is fulfilled by the two muscles. So this is the flexor digitorum superficialis and the flexor digitorum profundus. So here are the two the muscles that will do this one. As you can see, this is the one of the muscles, and then here it will attach the tendon of these muscles. It will be attached to individual fingers, except the number one finger, except number one. So the rest of the fingers will have the a tendon that is going to attach to them. But sometimes people don't have this one here. Okay, so so the 25% of the people, which is the flexor digitorum superficialis. So here, with the next picture, we can see that this tendon that is going to attach to the fingers is going to attach to one of the phalanx. So the phalanx in every finger, there are two phalanx. There are three phalanx. Only with the number one, it have only two, but the other one it have two phalanx, and it has interphalangeal joints are two. So these superficialis, which is the flexor digitorum superficialis, is going to bifurcate at the end and then attach to the distal portion of the middle phalanx of all the other fingers, as you can see here. Okay, so we will see it in another view, which is here. You see it will go here and it will attach to the distal end of the middle phalanx, and here it is. And what it will do is, this is the superficialis, is going to flex the PIP. Okay, with the other one, which is the flexor digitorum profundus, is going to attach to the last one, which is the distal end of the second and the proximal end of the last one, or the third phalanx. So here, as you can see it, you can look here to see. So here is, this is how the other one is going to come. Is going to attach here and attach here, and then you see the superficialis is going to attach right there. Okay, it's going to attach right there at the end. It's going to attach this one. And let's see in another view. Here it is. You will see this is the attachment of the superficialis, and here is the attachment of the distal, of the profundus, here. Flexor digitorum profundus right here, flexor digitorum superficialis in the middle phalanx. So what they will do is, the superficialis is going to flex this finger. Here is flex at the PIP. It's going to flex at the PIP, and the examiner is going to hold the other fingers down, and it will ask the patient to flex each individual finger to see if the flexor digitorum superficialis is working. And if you want to test for the flexor digitorum profundus, you're going to see the distal interphalangeal joint. Profundus, that's with the distal. Okay, so you're gonna see the distal, and that is how you're going to check for those two muscles. And so these muscles are innervated by the we'll talk about the innervation in another section, I'm sure. Okay, so that's it.